Anatomically speaking, the forearm is the part of the upper limb between the elbow and the wrist joints. It contains two bones, the ulna and the radius, which provide support to local muscles supplied by an intricate network of nerves and vessels. On the anterior part of the elbow, there's a triangular fat-filled pit called the cubital fossa, which is where the majority of important nerves and vessels to the forearm and hand can be found. Okay, before we start, it's important to know that even though some of the muscles of the forearm attach proximally to the humerus, they still belong to the forearm. The forearm is divided into two compartments, which are separated by the radius and the ulna, and the interosseous membrane running between them. We have the anterior compartment, which contains flexors and pronators. Next is the posterior compartment, housing the extensors and supinators of the forearm. Generally, muscles in the same compartment are innervated by the same nerve. So the muscles of the anterior compartment are generally innervated by the median nerve, with a few muscles being innervated by the ulnar nerve. Muscles of the posterior compartment, on the other hand, are innervated by the radial nerve. Now, the muscles of the anterior compartment are divided into three groups, or layers: superficial, intermediate, and deep. In the superficial layer, there are four muscles which all arise from a common tendon attached to the medial epicondyle of the humerus. So this attachment site is called the common flexor origin. Muscles attaching to the common flexor origin are the flexor carpi ulnaris, the palmaris longus, the flexor carpi radialis, and the pronator teres muscles. Enjoying our Osmosis videos? Unlock your full potential with an Osmosis subscription. Get unlimited access to every Osmosis feature and resource with a free 7-day trial. Now, let's look at these muscles one by one. On the most medial side lies the flexor carpi ulnaris. This muscle has two heads: the humeral head that proximally attaches to the medial epicondyle of the humerus, and the ulnar head proximally attaching to the olecranon and the posterior border of the ulna. As these two move distally to the wrist, they fuse into one tendon that crosses the wrist to distally attach to three bones: the pisiform, the hook of hamate, and fifth metacarpal bone. Although muscles of the superficial layer are primarily innervated by the median nerve, the flexor carpi ulnaris muscle is an exception because it is fully innervated by the ulnar nerve. This muscle mainly flexes and adducts the hand at the wrist joint. Lateral to the flexor carpi ulnaris, there is the palmaris longus muscle. This muscle proximally attaches to the medial epicondyle of the humerus and extends distally to form a tendon that attaches to the distal half of the flexor retinaculum and the apex of the palmar aponeurosis. The palmaris longus muscle is innervated by the median nerve. When it contracts, it flexes the hand at the wrist. A little fun fact about the palmaris longus: it is absent in about 14% of people, but luckily, its absence doesn't come with any functional deficits. Lateral to the palmaris longus, there's the flexor carpi radialis muscle, which also proximally attaches to the medial epicondyle of the humerus. It extends distally and laterally to the middle of the forearm, forming a tendon that attaches at the base of the second metacarpal bone. The flexor carpi radialis is innervated by the median nerve. When it contracts, it flexes and abducts the hand at the wrist joint. Finally, there's the pronator teres, which is the most lateral muscle of the superficial muscles in the anterior compartment. It also has a humeral and an ulnar head. Proximally, the humeral head attaches to the medial humeral epicondyle, while the ulnar head attaches to the coronoid process of the ulna. As the muscle extends distally, its two heads fuse into one tendon that attaches to the midshaft of the radius on its lateral aspect. The pronator teres is innervated by the median nerve, and its contraction pronates and flexes the forearm at the elbow. Okay, now what if we take a 1-minute pause to just flex your wrists? At the same time, try to remember the muscles that attach to the common flexor origin. Now let's have a look at the intermediate layer of the anterior compartment of the forearm. It's a one-muscle compartment containing only the flexor digitorum superficialis. This muscle has two heads, a humero-ulnar head that attaches to the common flexor origin and the coronoid process, and a radial head that attaches to the superior half of the anterior border of the radius, also called the anterior oblique line. Moving distally, the two heads of the flexor digitorum superficialis fuse together in the middle of the forearm, and that eventually splits into four separate tendons at the level of the wrist. All of these tendons pass deep to the flexor retinaculum in the carpal tunnel, eventually attaching to the shafts of the middle phalanges of the medial four digits. The flexor digitorum superficialis is innervated by the median nerve, and its actions depend on how hard it's contracting. When it contracts moderately, it flexes the middle phalanges at proximal interphalangeal joints of the medial four digits. With a stronger contraction, this muscle flexes the proximal phalanges at the metacarpal phalangeal joints. Finally, let's look at the three muscles of the deep layer of the anterior compartment of the forearm: the flexor digitorum profundus, the flexor pollicis longus, and the pronator quadratus. The flexor digitorum profundus has two proximal parts, a medial and a lateral part, and both of them attach to the proximal three-quarters of the anterior aspect of the ulna and the interosseous membrane. Distally, the medial part splits into two tendons to attach to the base of the fourth and fifth distal phalanges, and the lateral part splits into two tendons to attach to the bases of the second and third distal phalanges. All the tendons pass posterior to the flexor digitorum superficialis and flexor retinaculum. The medial part functions to flex the distal phalanges of digit 4 and 5 and the distal interphalangeal joints, while the lateral part does the same thing for the second and third digits. An important distinction here is that the lateral part is innervated by the anterior interosseous nerve, a branch of the median nerve, while the medial part is actually innervated by the ulnar nerve along with the flexor carpi ulnaris. To easily remember this, think of how the flexor carpi ulnaris and the medial part of the flexor digitorum profundus are both medial and are closer to the ulnar side of the forearm. This will remind you that they are innervated by the ulnar nerve as it travels more medially in the forearm as well. Next up, there's the flexor pollicis longus, which attaches proximally to the anterior surface of the radius and interosseous membrane. As the flexor pollicis longus extends distally, it transforms into a flat tendon that passes under the flexor retinaculum of the hand through the carpal tunnel to insert to the base of the distal phalanx of the thumb. The flexor pollicis longus is innervated by the anterior interosseous nerve, which is a branch of the median nerve, and it causes flexion of the thumb. Finally, there's the pronator quadratus muscle, which is a quadrangular muscle found deep to the other muscles in the anterior compartment. Proximally, it attaches to the distal quarter of the anterior surface of the ulna, and it extends laterally and distally to attach to the distal quarter of the anterior surface of the radius. The pronator quadratus is innervated by the anterior interosseous branch of the median nerve. When it contracts, it is the primary pronator of the forearm, while also helping to hold the radius and ulna together. Now, it's also important to know that the majority of these flexor tendons from the anterior compartment are held in place to prevent bowing by both the palmar carpal ligament and the distal and deeper flexor retinaculum, which is also known as the flexor retinaculum. Both of these can be found on the anterior surface of the hand and wrist. Furthermore, a lot of these tendons are enclosed in either common synovial sheaths or individual synovial sheaths, which allow the tendons to slide freely over each other during movements. Okay, let's take another pause here and see if you can remember the only muscle of the intermediate layer and the three muscles in the deep layer of the anterior compartment. So let's now move to the posterior compartment of the forearm. The muscles of the posterior compartment are all innervated by the radial nerve, and they're mainly extensors of the wrist and digits. In a similar fashion to the flexor muscle tendons, the extensor muscle tendons are held in place posteriorly by the extensor retinaculum. which is this thickened part of fascia on the posterior aspect of the wrist to prevent bowing of the tendons. The extensor tendons also have synovial tendon sheaths to reduce friction during movement. The posterior compartment muscles are divided into a superficial and deep layer. The superficial layer has 6 muscles: the brachioradialis, the extensor carpi radialis longus, the extensor carpi radialis brevis, the extensor digitorum, the extensor digiti minimi, and the extensor carpi ulnaris muscle. The brachioradialis is the most lateral muscle in the superficial layer. Although it is anatomically grouped in as an extensor muscle of the posterior compartment due to its location, the brachioradialis is functionally counted as a flexor because it is a weak flexor of the forearm. Its proximal broad part attaches to the proximal 2/3 of the lateral supraepicondylar ridge of the humerus, and then narrows down as it extends distally to attach to the lateral surface of the distal radius, proximal to the styloid process. When it contracts, it flexes the forearm, especially if it was in a mid-pronated position. This muscle is also known as the beer drinking muscle because it gets a real workout when you drink a can of beer. The second muscle is the extensor carpi radialis longus. Its name itself, the extensor carpi radialis longus, implies that it's a long muscle that runs alongside the radial bone and that it extends the wrist. So it attaches proximally from the lateral supraepicondylar ridge of the humerus and crosses the wrist to attach to the base of the second metacarpal bone. When it contracts, it extends and abducts the hand at the wrist joint. Next up, there are 4 muscles which have a common proximal attachment: the extensor carpi radialis brevis, the extensor digitorum, the extensor digiti minimi, and the extensor carpi ulnaris. They all attach to the lateral epicondyle of the humerus, so this is the common extensor origin. In the distal forearm, the extensor carpi radialis brevis crosses the wrist and attaches to the base of the third metacarpal bone. It functions in the same way as the extensor carpi radialis longus, to extend and abduct the wrist. The extensor digitorum occupies most of the posterior surface of the forearm, and from its attachment to the lateral epicondyle, it eventually splits into 4 tendons and travels deep to the extensor retinaculum. These tendons pass deep to the retinaculum and then spread as they move along the dorsum of the hand, where they attach to the extensor expansions of the medial 4 digits. The extensor expansions wrap around the dorsum and sides of the metacarpal head and proximal phalanx, forming a hood and keeping the extensor tendon in the middle of each digit. This muscle acts to extend the medial 4 digits at both the metacarpophalangeal and interphalangeal joints. Now, as the extensor digiti minimi extends distally, it forms a tendon that also passes deep to the extensor retinaculum, but in a separate compartment. In the hand, it ends up attaching in the extensor expansion of the 5th digit and extends the 5th digit, both the metacarpophalangeal and interphalangeal joints. The 6th and final muscle in the superficial layer of the posterior compartment is the extensor carpi ulnaris muscle. It also attaches to the lateral epicondyle of the humerus as well as the posterior border of the ulna, and then extends distally in the forearm, forming a tendon that crosses the wrist to attach to the base of the 5th metacarpal bone. Its function is to extend and adduct the hand at the wrist joint. The extensor carpi radialis brevis, extensor digitorum, the extensor digiti minimi, and the extensor carpi ulnaris are all innervated by the deep branch of the radial nerve, which is a distal branch of the radial nerve. Now let's switch gears and look at the deep layer of the posterior compartment. It contains 5 muscles: the supinator, the abductor pollicis longus, the extensor pollicis brevis, the extensor pollicis longus, and the extensor indicis. The abductor pollicis longus and the extensor pollicis brevis and longus are referred to as the outcropping muscles of the deep layer because they emerge or crop out in a small trench that separates the extensors in the lateral forearm. First, the supinator lies deep in the cubital fossa, forming part of its floor. It's a broad muscle with proximal attachment spanning across the lateral epicondyle of the humerus, the supinator crest and fossa of the ulna, the radial collateral ligament, and the annular ligament. It then spirals medially and distally to broadly attach to the lateral, posterior, and anterior surfaces of the proximal third of the radius. It is innervated by the deep branch of the radial nerve, and its contraction supinates the forearm by externally rotating the radius. Alright, now let's move on to a group of 3 muscles referred to as the outcropping muscles of the deep layer. These 3 muscles are all innervated by the posterior interosseous nerve, the continuation of the deep branch of the radial nerve. The first outcropping muscle is the abductor pollicis longus, the most lateral of the 3 muscles. It proximally attaches to the upper halves of the ulna and radius, plus the interosseous membrane. It then attaches to the base of the first metacarpal bone. When the abductor pollicis longus contracts, it abducts the thumb and extends it at its carpometacarpal joint. Next, there is the extensor pollicis brevis muscle, which runs closely beside the abductor pollicis longus. It proximally attaches to the distal third of the radius and the interosseous membrane. It then attaches at the base of the proximal phalanx of the thumb. When this muscle contracts, it extends the proximal phalanx of the thumb. Next, there's the extensor pollicis longus. Its proximal attachment is to the middle third of the ulna and the interosseous membrane. It then attaches to the base of the thumb's distal phalanx after it crosses medial to the dorsal tubercle of the radius to create space between it and the extensor pollicis brevis. When the extensor pollicis longus contracts, it extends the thumb at each of its joints, including the interphalangeal joint. Finally, there is the extensor indicis muscle. The proximal attachment of this muscle is to the posterior surface of the distal third of the ulna and interosseous membrane. At the wrist, the extensor indicis forms a tendon that crosses the joint to attach to the extensor expansion of the second digit, aka the index finger. The extensor indicis muscle is innervated by the posterior interosseous nerve, which is the continuation of the deep branch of the radial nerve. When this muscle contracts, it extends the index finger and has a minor role in extending the wrist. Now, back to the outcropping muscles. As the tendons of the extensor pollicis longus and the extensor pollicis brevis cross the wrist to their attachment points, the gap between them forms a triangular-shaped depression over the trapezium and scaphoid bones. This depression is often referred to as the anatomical snuff box. The abductor pollicis longus and the extensor pollicis brevis makes the anterior boundary of the anatomical snuff box, while the extensor pollicis longus makes the posterior border. To remember the anterior boundary, think of the B in extensor pollicis brevis being a buddy to the abductor pollicis longus, where the extensor pollicis longus on its own forms the posterior boundary. You can also think of it as a brevis sandwich between the 2 longus muscles. Brevis sandwich. But anyway, the anatomical snuff box can be seen when the thumb is fully extended. And it's an important landmark because the radial artery can be palpated against the floor of the snuff box, which is made up by the trapezium and the scaphoid bones. Now for a quick break. Can you remember the muscles of the superficial layer of the posterior compartment? Alright, as a quick recap. The anterior compartment of the forearm has 8 muscles divided into a superficial, intermediate, and deep layer. There are 4 muscles in the superficial layer: the pronator teres, the flexor carpi radialis, the palmaris longus, and the flexor carpi ulnaris. In the intermediate layer, there is only 1 muscle, the flexor digitorum superficialis. In the deep layer, there are 3 muscles, the flexor digitorum profundus, the flexor pollicis longus, and the pronator quadratus. In the posterior compartment, there are 11 muscles divided into a superficial and deep layer. The superficial layer has 6 muscles, the brachioradialis, the extensor carpi radialis longus and the extensor carpi radialis brevis, the extensor digitorum, the extensor digiti minimi, and the extensor carpi ulnaris. In the deep layer, there are 5 muscles: the supinator, the 3 outcropping muscles, which are the abductor pollicis longus, the extensor pollicis brevis, and the extensor pollicis longus, and last but not least, the extensor indicis. Finally, the anatomical snuff box is a superficial landmark on the posterolateral wrist, of which the abductor pollicis longus and the extensor pollicis brevis make the anterior boundary, while the extensor pollicis longus makes the posterior border. Helping current and future clinicians focus, learn, retain, and thrive. Learn more